So I'm going to take a few minutes and go through different things that people want to know about the stellate ganglion block, and hopefully address some questions or concerns that people have about the procedure in the meantime. It's one of the most gratifying things that I've ever done in medicine to do this procedure. It sounds a little too good to be true to some people. And when I first heard about it, I sure thought it was. It's not magic. It doesn't work for everybody, but it really helps a lot of people, and it can be life-changing for a lot of people. We use it to treat PTSD. It's been around, the procedure's been around for a long time, more than 50 years. And thankfully, back in the early 2000s, Gene Lipoff figured out that this helped PTSD if we used the same procedure. Since that time, a few physicians have been using this to treat PTSD, and it's becoming more widely known and accepted as a treatment for PTSD. Sometimes we'll see some benefit with chronic anxiety as well, because there are some overlaps. Anyway, the procedure works by resetting your emotional set point. Your brain and your body are always in communication, and when a person has PTSD for whatever reason, there's too much communication going on between the brain and the body from in what's called the sympathetic nervous system. And so that's what's responsible for your fight, flight, or freeze responses. The stellate ganglion block makes it so that there's a disruption for about 6 hours, 8 hours or so between the brain and the body when it comes to the sympathetic nervous system. And for whatever reason, that allows for the person's ability to react more appropriately or act more appropriately to situations that are stressful. That gets reset, and it's really profound when it works. It's not, there's a range of effects that people will get from the procedure. The ones we love and we all want are the ones that are, amazing, where we went from some of those having a lot of trouble functioning socially or with their family to being able to do that in a much more normal way. And that's awesome when that happens. And that's a good majority of the time we do see that. It can happen where someone has a less severe, or not severe, less impactful change. And it can be as mild as a person's spouse will say, well, he or she is better, and they are easy. It's easier for him to talk to the kids or hang out with their kids. It's easier for her to be in a social situation, or this happened, XYZ thing happened that would have really made the person upset, and they didn't get as upset. So we would love it if all of the patients feel an amazing relief, but sometimes it's just as subtle as that. I would say, though, for the majority of people, when you have an effect with this, it's profound and significant. The procedure is an injection of local anesthetic. It's the same kind of stuff that the dentist uses to numb up your face or your teeth when he or she's doing a dental procedure. So the only difference is, instead of putting it next to a sensory nerve, we're putting it next to sympathetic nerves. And these nerves are turned off in much the same way that the sensory nerves are turned off in your face for the period of time that the medicine's there. There's not an anesthetic where we knock you out. It's not like you're going under for surgery. There's no psychedelic medication or anything that changes your perception of reality. This is just resetting the way that your mind and your body are communicating. People can get the effect from the procedure within a few minutes of the injection. After I do the procedure, and I'll talk more about the procedure and what a person could expect here in a second, but after I do the procedure, I have a patient lay on the bed for about 20 minutes after and keep an eye on their vital signs and walk them through any side effects that are happening, because I want to be able to coach a person, to help it be less disturbing. So it's pretty common where during that 20-minute observation period, somebody will feel an improvement, and it can be an extremely strong emotional reaction. We do see this with some regularity. My gut is about 30-35% of the time, where someone has just starts crying or feels very sad. I've done several hundred of these, and twice now I've had someone that was just laughing uncontrollably, which was pretty funny. The person's, I have no idea why I'm laughing. They're just laughing. That's not the thing we usually see. But again, we can have these strong emotional reactions that happen. Other times what we'll see is that people will just report that they can breathe easier, or they feel as though there's a weight that's been lifted off of their chest. And again, right there while we're watching them after the procedure, it can be pretty neat. Sometimes it takes up to a week for the effects to occur. And so I usually, if we're going to talk about doing a second side procedure, I usually tell people, well, let's wait a week. And then because you may have additional benefit during that time period. So there's a range as far as when you can expect a change to occur. As you know, you have two sides to your body, so we have to make a decision as far as what side to do, what side are we going to do the procedure on. I usually start with the right side, because better than 80% of people, or right around 80% of people, have a good effect with the right side. So we're kind of playing the numbers to try to make it so that the best outcome happens. If we do the right side and the person does not get an effect, well, and there's going to be 20% of people that don't get an effect from the right side, then we do, on a different day, we do the other side, the left side. And it's about half of those people that come back to get their left side done will get an effect from the left side. If we're treating chronic anxiety, or if we're using this to treat long-haul COVID or other things, and there's some evidence that supports the use of that, I usually tell people we should just plan on doing two sides, because the way that it seems to work is that one side gets rid of the big stuff, so to speak, and the other side gets rid of the rest of it. The analogy I always use is if you calm down the trumpets, you can hear the piccolos. So it can take care of some problems. The right side can take care of some symptoms that the patient's having, and yet they can still have some other additional benefit from getting the other side done. If we're treating pure PTSD, then to do one side and see how you do, and then do the other side if you need it is a good way to go. But again, that's not the only reason we use the stellate ganglion block. To help people. The effects of the procedure can last for years. If I do a procedure on somebody and they get a good response, that day or within the next week, usually that's something, that kind of took care of the trauma that happened to the person up to that point in their life. A colleague of mine has a patient who is about 15 years out from the treatment and still doing great. So there is durability to this procedure. If, however, something traumatic happens to you, you get sued, you get divorced, have some sort of physical assault or something terrible happen, this does not prevent, let's say we do a procedure today and God forbid something happens a week from now or a month from now or 3 years from now, the procedure we did today does not help prevent, that trauma from encoding in a way that can be problematic for people. So if any of those things happen, I would expect that there probably would be some recurrence of the symptoms of PTSD, in which case we could absolutely repeat it. If your job is your trauma, if you're, frontline healthcare worker, a warfighter, or some high-stress job, stockbroker, or something like that, to do it every 3 or 4 months, sometimes that's something that we choose to do, because you can have re-traumatization on a regular basis, expect to have that on a regular basis, and expect that you could get additional benefit from repeat procedures. Talking about one side or two, you cannot do two sides in the same day. I know there are some, basically what it comes down to is we're putting a long-acting medicine in the neck, and there are nerves that sometimes get medicine on them, and we'll talk about side effects here in a second, but that are right next to where we're trying to go, that make it hard to swallow, and they make it hard to protect a person's airway. Meaning if something flies in there and goes down and it makes you cough, you can't protect your airway very well. Also, these nerves help keep the vocal cords open. So part of the reason that the voice is affected is that the vocal cords on one side aren't working right. If you do that on both sides, then the danger would be that a person could not breathe. And that's obviously a problem. We have to be able to protect our ability to breathe. So that's why we can't do two sides on one day. So let's talk about side effects. What can we expect with side effects of this procedure? Most of the side effects last for about 6 hours, and they have to do with the fact that the medicine that we're using is going to have an effect on the nerves around it, around where the sympathetic chain is. So the three things I want to have happen: I want to have a person have a small pupil, I want them to have a droopy eyelid, and I want them to have a bloodshot eye. Those three things together are called a Horner syndrome. It's not important, but it's important that we have it, because that tells me whether the medicine is where it should be. So that's something you can expect as a side effect. And again, lasts for about 6 hours. Most people get stuffy, get a stuffy nose on one side, and most people get mucus that like post-nasal drip. This has to do with the fact that we're increasing the blood flow to one side of the face, and as you increase blood flow to the lining of the nose and the sinuses, it increases engorgement. They get bigger, and so that the passageways get smaller, and the production of mucus increases. So you can expect that you have fullness on the side of the face, warmth on the side of the face sometimes. You kind of feel stuffed up, and you feel like there's mucus going down the back of your throat. So that's pretty common. A lot of people have difficulty speaking, and then kind of their voice becomes hoarse, and they talk like this because their vocal cords aren't moving like they should. Swallowing is also a problem for most people, and it's important that you don't try to swallow anything until your swallow starts working again. Some people feel as though they have a difficulty getting the last 10 or 15% of their breath. When they're taking a deep breath, they feel like they just can't do it. I always mention this because anxiety and breath are often, so tied. And if you feel like you can't breathe, you're going to become more anxious. For anyone that has that happen, I just coach them, don't take a deep breath. Just breathe in the center of your breath. When I do the procedure, I'm watching people's heart rates, oxygenation, and blood pressure. And I've never seen anybody's oxygen levels drop because they couldn't breathe. That's not something that we see happen. So I just reassure people it doesn't feel great if that happens. So just breathe as normally as possible and you'll be just fine. Most people kind of feel tired after the procedure, just want to go to bed or want to go someplace that's nature, or outside, peaceful. This can last for the feeling of tiredness can last for about 6 or 8 hours as well. I have had a couple patients who have felt tired longer than that, but eventually, up to a couple days, but eventually that has gone away without any problem. The side effects that can happen the next day are headache, and that can be pretty bad, and nausea can happen as well to the point where a person vomits. So, if that happens, we usually give a person a nausea medicine. We'll call it into a pharmacy near where they are, or we have them take Tylenol for the headache. I'm going to talk through what to expect when you're having the procedure done on the day of the procedure. We do it here in the clinic, and there's some places they do it in ambulatory surgery centers. I like doing it in the clinic setting because it's a little calmer. And we've got more it's a little bit more peaceful of an environment. This is kind of the only thing we're doing here. We do a few other things, but it's not like we're doing surgeries where we have a really sterile environment in how it looks. We maintain cleanliness and the procedure is done sterilely, but it's a little bit less confronting when you come into a clinic setting. You'll be laying on the bed and on your back, and we'll have you turn your head off to the side like this. We'll have you on the cardiac monitor, like I said. Oftentimes we'll put an IV in your arm just in case anything happens. We can react to that. We'll watch your vital signs during the procedure, so that's why we have you on the monitor. The ultrasound is used to find the safest path between your skin and the target where we're trying to get to. There's a little bit of pressure on the neck here while that's happening, and we use a cleaning solution to clean the neck off before we do the injection. Put some pressure on the neck with the probe. Once I find the spot where we need to go, it's a quick skin poke, and the needle's inserted into the area where the stellate ganglion or the sympathetic chain is. I can see the needle the entire time, but as an extra safety measure, we pull back on the plunger of the syringe, and just to make sure that there's no blood coming back, and that's just to make sure that we're not in a blood vessel. Once that's done, we will inject slowly into the area and watch the medicine spread. Usually we'll do a second level on the same side, so there'll be two skin pokes on the same side. Once that's done, we hold some pressure on the neck, and then we watch you for about 20 minutes, like I said. If there are any side effects that happen, we will talk you through those and do our best to help with things that are disturbing. After the observation period, if everything's looking good, we'll sit you up, and then we'll stand you up, and we'll send you on your way. You'll need a driver because people were a little bit out of it after the procedure. And I always recommend to go from the table where the procedure is happening to the most peaceful place you can think of. Bed is good. Like I said, nature is good as well. Stay off of screens. Stay away from places where you have responsibilities. I would not suggest getting in a car, even as a passenger, and driving in traffic. Try and kind of be chill and relax and let your brain and your body reconnect and recalibrate. So that's kind of the overview of what you can expect with the stellate ganglion block, reasons we do it, how it's beneficial, possible downsides. So if you have any questions, reach out through my website, through my staff. Be happy to answer those questions. I hope this was helpful and talked through a few things that people want to know when it comes to stellate ganglion block.